our allowances!
We need our allowances!
We need our allowances!
We need our allowances!
No money, no work!
No money, no work!
That was the situation Friday morning on East Street, Georgetown, where nurses from the Georgetown Public Hospital staged a protest for better wages and other benefits. The protest comes after nurses in Linden, the West Bank, and the West Coast of Demerara held similar protests on Wednesday and Thursday. The nurses at Gphc threatened that if their demands are not met, they will not be working. Their position is that since they are essential workers during the pandemic, they should have essential pay. Nurse John Allen spoke with reporters.
We all here, some of our staff are here, standing in solidarity, making a firm statement that we will need our allowances that was promised for us for months. Since COVID had started, there are a lot of nurses here who have been on quarantine for weeks, being away from their family, from their friend, from their loved one, sacrificing. So we need our allowances, we need it. If we're not having our allowances, we're going to take this stand on a daily basis until our demands are being met. Yeah. There's a lot of us here from Georgetown Public Hospital who are not on our pension plan because of the year in which this cooperation would have became a cooperation. So there are a lot of us who aren't allowed any pension, or who aren't pensionable, or who aren't even receiving a gratuity. All right, I'm a nurse for almost 9 years, and what is there for me? There's no benefits. Why am I going to stay here for 33 plus years when I wouldn't be receiving any more pension, when I'm not pensionable?
A doctor attached to the Georgetown Public Hospital and 2 other nurses also spoke about their experiences working during the pandemic, as a number of healthcare workers have already been exposed to the deadly disease.
All healthcare workers should be together in this struggle because a long time we're dealing with a lot of grievances in the health sector. Since in the previous administration, and even before then, we had a lot of serious grievances and it was not addressed. So if this mobilization got to start the new wave, then we got to do it. Because we got a lot of grievances that we need to solve. We need PPEs, proper PPEs for our healthcare workers. We need our overtime, non-tax, and all these things. We need land for the public servants, and we need our increases for the year.
Most days when we turn up to work, our supervisor has to work all over, look into the spends gone for us. The persons who are working in the night shift are forced to be wrapped with sheets to protect themselves. This is very unfair. You can't bill in billboard for someone that come in for 24 hours and the nurse doesn't have PPE. We are being treated unfair. It's not that we don't want to work, we want to work. I'm one of the most dedicated nurses at Gphc. But if we're not protected, we have our families to go home to.
They're spending money on inconsequential things. Let them spend on things that are worth it, like the nurse's salary, increases in salary. We need that today, or we're not working. It's going to be radical if they don't do something about this now.
Representative of the Ghana Public Service Union, Owen John, said the union stands with the nurses during this time.
GPSU stands with the workers in this struggle. Nurses are not receiving a living wage. They get a salary today. By the next 10 days, they got to be borrowing money to live all the month. That is what's happening. You got to give people a living wage. Give them conditions of service that make sense. Give them equipment to work with. Give them resources to work with.
Nurses attached to the Suddie Hospital in Region 2 and the New Amsterdam Hospital in Region 6 also protested for better working conditions. Meanwhile, Minister of Health Dr. Frank Anthony on Thursday asked the nurses to be patient until the budget is passed. The budget is expected to be passed Friday in the National Assembly, and the health minister said some $150 million have been allocated to pay risk allowances to health workers. Reporting for the newsroom, I am Isanella Patwo.